Now I'd like to introduce this week's keynote speaker from the Northeast Georgia Health System's Heart Center Beaufort office, Dr. Naga Kommuri. Dr. Kommuri specializes in cardiovascular wellness screenings, clinical cardiology, and other cardio services. Please welcome Amy Philo, Cardiology Business Development at the Heart Center of Northeast Georgia Medical Center, as she sits down with Dr. Kommuri today.
Dr. Kommuri, thanks so much for joining us today. We're so glad you could be here. Tell us a little bit about your background, where you came to us from.
Thank you for having me today. I'm Dr. Kommuri. I'm one of the cardiologists who recently joined the Heart Center with Northeast Georgia. Briefly regarding me, I trained in India, did my med school there, and did my MD from UK, then came to here and did my medicine as well as cardiology from Metro Detroit, and preferred to come to a better weather, so came over to Atlanta. Have been working at Emory Hospitals with a private group for the last 3 years and decided to make a switch to Northeast Georgia Health System. My special area of interest is predominantly preventive cardiology as well as imaging.
So we've had a lot of advances in imaging over the past few years with cardiac CT, cardiac MRI, cardiac with FFR. Can you talk a little bit about those advances in imaging and what we can see now versus maybe what we could see 10 years ago, and the things that we can see more of using potentially a non-invasive test versus having to use something that's invasive?
Cardiac imaging has definitely advanced a lot in the last decade, especially with CT and MRI. With regarding to CT, now we are able to, in the right set of patients, you're able to get the same images and the same type of information as you would get in doing an invasive angiogram. And also, you're able to risk stratify these people who previously were thought to be of less risk because of the CT. And MRI is an additional enhancement, especially in people with heart failure, to diagnose different types of reasons for their heart failure.
What are some of the special types of patients you like to treat? I know you mentioned that you do a lot of preventative cardiology, but what is some of those challenging patients that you treat, some of those with different comorbid conditions? What do you find interesting about those patients?
Treating patients with comorbid conditions has always been a challenging experience, but it is also the most gratifying thing because you are able to make change and make them feel better and live longer. Most people, when they have congestive heart failure, in most instances they would have already a couple of other medical issues. The goal is to make sure that their quality of life is good and try to make them live longer and see if they would qualify for any of the advances in the field like LVADs, transplant and other stuff. And we at Heart Center here do LVADs and offer other advanced treatments in congestive heart failure.
Now that we're facing the COVID epidemic, we've been in the middle of this for quite a while now. I know that you're seeing patients who are scared. You're also seeing patients coming in with lots of comorbid conditions that have potentially put off coming in until later on because they're scared of coming to the doctor's office. They're scared of coming to the hospital. What are you seeing, and then what are you telling these patients and your staff and your practice? What are they telling these patients that are scared to come to the hospital? They're scared to come into the doctor's office to see you. What reassurances are you and your staff giving them?
I mean, COVID has always been an eye-opener and game changer for all of us. So there's something which has become new norm, but what we are trying to do is make sure our patients are safe and make sure that their issues are met with. So in that way, we are trying to do multiple things to help our patients, like televisits, phone calls to the patients. And we are also, even in the offices and in the other clinics where we go, we try to make sure there's minimal interaction for the patients, whether it's be in the waiting room or we try to room them into their rooms straight away, and everyone is made sure that everyone has a mask on. So in that way, we're taking all the precautions so that the risk of any transmission of COVID, at least during this visit to the office or clinic, is extremely low.
So we talked about those patients that are still scared to come in, they're still hesitant. You know, you're hearing stories from across the country and stories in our own area where patients have been having chest pains for days and weeks, but yet they've delayed in seeking care, they've delayed in coming to the emergency room. What advice would you give those patients about making sure they seek treatment sooner rather than later?
It is an unfortunate thing, but it is a reality that a lot of patients are seeking care later than what they are supposed to be. And that's been a big challenge from the medical community to address and try to reassure the patients that we are taking all the necessary precautions to take care of them. If they have any issues, they should definitely contact us. And if there is something which we can do as a televisit, we would be more than happy to offer the televisit. But in some situations, televisit is not the right thing for the patient, and then we try to make sure, see them at the earliest, even try to do a walk-in if needed and take care of their issues.
What are some early signs and symptoms that patients could be looking for if they think they might be experiencing some cardiac trouble?
Predominantly in heart failure patients or in heart disease patients, the symptoms you're watching for, any new onset symptoms of chest pain, shortness of breath, anything which has changed all of a sudden in the last week, those are the symptoms which we are watching for. And most of our heart failure patients know that if there is any weight gain and if it hasn't responded to oral diuretics, that's when they have to come into the office to take care. And most of our CAD patients know that if there is any new onset symptoms of chest pain or shortness of breath, they're supposed to come in. Unfortunately, there has been a trend where we are seeing sometimes, especially in the newer patients, when they have this chest pains, they try to dismiss it or don't want to go to ER because of this concern about COVID. And sometimes because of that delay in care, sometimes unfortunate things do happen.
So we've all heard about wearing a mask and social distancing, limiting our, groups of people, avoiding large crowds, things like that. So from your perspective, from a physician's perspective, can you tell us what are some of the things that we can do to prevent the spread of COVID in our own area, in our own community?
Excellent question. COVID is a viral and a respiratory illness. So the most important things is, which we already know, but we have to practice them, which is social distancing, using a mask, hand washing. These are the most important things. The moment you step out of the house, you need to wear a mask. That's the most important thing which you can do so that you can minimize the chance of you getting an infection from someone or minimize the chance of you giving that infection to someone else. And also, people who are at high risk should not venture out unless it is absolutely needed. And the other thing which you want to make sure is avoid big gatherings. And the other thing important is anyone who can work from home should work from home. The essential workers who cannot work from home are the ones who are supposed to go with taking all the above precautions which I mentioned.
I know we're hearing a lot in the news about vaccines that are being developed, different ones that are under investigation, numerous companies that are working on these. I know they've started clinical trials on a number of different types of vaccines. What does that vaccine scenario look like right now?
Excellent question, Amy. Regarding the vaccine, currently there are multiple vaccines across the world which are being developed, and there are multiple of them in the later part of the trials, which is phase 3 trials, which generally will take at least several more months to complete. And there are some other vaccines which are in phase 2, which will take a longer period of time. The main purpose of the vaccine trials is to make sure that it is safe and it can be given to all the healthy people, and it produces the enough immunity which they are looking for, so that we can all be protected for this COVID situation.
So I know that there are a lot of people out there that are scared to take a new vaccine when it first becomes available. Being in the healthcare industry like I am and like you are, we will more than likely be some of the first ones that will be required to take this vaccine. So talk to me and talk to those people that are scared about taking a new vaccine when it first comes out.
I understand the skepticism about taking something which comes new, but one thing you have to remember is for a vaccine or for any medication to come out, it goes through multiple trials, and a lot of people had it and they were followed up to make sure it is safe and effective before it is given to common population, common public. So if I were you, I would definitely take it, and once the vaccine comes, I'm happy to take it. And if you still have concerns, we as your healthcare providers, we are more than happy to answer your questions and alleviate your fears.
When you're facing cancer, you want a winning team on your side, or even better, two. That's why Northeast Georgia Medical Center is now an affiliate of the Winship Cancer Institute of Emory University, a new collaboration that gives you access to more treatment options and promising clinical trials, all at convenient locations that keep you safe and close to home. Northeast Georgia Medical Center, now an affiliate of Winship at Emory. More voices, more victories.
Welcome back, Dr. Kommuri. Again, thanks for taking time to talk to us today. So our main audience today are people ages 50 and up, and a lot of them are concerned about what's going on with COVID. We've already talked about COVID. Some of the challenges that we seem to be facing in the community and with my family and with your family is that folks aren't able to see their relatives. The older folks aren't able to see their grandkids. They aren't able to see their kids. What effects are you seeing on those folks as far as stress and mental health issues? What kind of effects is that having on the people who are 50 and above?
That's an excellent question, Amy. Regarding stress and mental health and cardiac issues, it has always been shown that stress increases a lot of issues in terms of health and especially cardiac issues. I understand COVID is a different scenario, and we, being social beings, not having interaction with other people is a very stressful thing. But I think we should do what we can in terms of minimizing the stress, whether it be meditation, trying to Skype or Zoom with your family, going for walks, or keep yourself engaged with other things. And if you have a closed loop where you're not going outside, like two families or one or two people where you can trust, you can possibly interact with them with appropriate social distancing and masks and other stuff.
So Dr. Kommuri, speaking from my own experience, my parents are in their 70s. They're missing seeing their grandkids. They're missing seeing me, their daughter. So we're doing as much, visiting by FaceTime and phone calls and different things like that. And I'm wondering if this is something you're seeing in your patient population as well. And then what are some additional things we can do to try to ease that stress of that older population that may be missing seeing their families?
That's a great question, Amy. Especially with older people, the biggest concern is they're not able to meet their family in person, which is causing them a lot of issues, mainly because for their mental well-being. What I would suggest, on top of doing the Skype, the phone calls, you can still meet outside with like drive-through visits where you're maintaining appropriate distance and not touching each other, using all the masks and other stuff, so that you're still having the interaction. We as a family, we are trying to do in my household, that's what we are doing, is we're spending more time with the kids, going on walks and biking and all the other things, and the kids are talking to their grandparents via Skype and all the other different media.
Talk about how important it is for folks, especially those 50 and above, to continue on with their regular yearly checkups, those mammograms, those annual blood tests. blood pressure checks, all of those things that they would normally do in a year when there's not COVID. Talk about how important it is for those folks to continue those preventative visits and those preventative screenings.
With regarding to following up with your regular doctors as well as keeping up with your annual physicals and other stuff, it is very important to do that, because a lot of times things get picked up at those visits, and sometimes picking up those things early will make a big difference between life and death or outcomes in a lot of people. So I would still suggest that you keep up with your regular visits and get your testing done as needed, and try to do televisits in situations where it is possible, and your physician will be able to advise you accordingly whether this is something they can do televisit, or whether they should still see you in person based upon your condition and your situation.
Dr. Kommuri, the question that nobody wants to ask, but we're going to ask it. What if I get COVID? I wake up, I've got a runny nose, I've got a fever, I can't decide, is it allergies, is it, I don't know, but I go get tested and the result comes back and I'm positive. Where do I go from there?
The common symptoms you're seeing are fever, cough, cold, something like any other upper respiratory tract infection. Sometimes loss of smell, and occasionally GI symptoms like vomitings and diarrhea. If you've been around people who had COVID, and also with the community transmission, which means people who did not have symptoms could still be transmitting COVID. If there is any new symptoms like these, you should rightfully suspect about COVID and get the testing done. You can always talk to your primary care doctor, who will refer you to the appropriate center where they can get the COVID testing done. And remember, getting COVID doesn't mean it's a death sentence. Most of the people recover. It's people who are at high risk, people with older and people with multiple medical issues who are at high risk. The key is to treat it early and seek medical advice early, so that the physicians can determine whether you need to be on steroids, whether you need oxygen support, or whether you need more advanced treatments.
So Dr. Kommuri, thank you so much for taking time to talk to us today. I'm so thankful you could be here and talk to me and this great group of folks that are attending the Generations Expo. We're so glad you could be here today.
Sure.
Dr. Kommuri is one of the cardiologists with the Heart Center of Northeast Georgia Medical Center. He sees patients in the Braselton and Buford offices, and if you need a cardiologist, he would love to see you. If you'd like to make an appointment, please feel free to call our office at 770-534-2020. Thank you.